is Erin McNally, and today I'm going to be presenting my research project for MDS. And my research project is on why should smoking be prohibited in public places. Just a quick graph to start off with. If you look at the graph, you can see that smoking is one of the most preventable causes of death here in the United States, and that's usually due to cancer, which is often what smoking will cause. Just a quick background, smoking is the most preventable cause of cancer in the world, like I said before. Many people who choose to not smoke are still at risk due to secondhand smoke exposure. A lot of public places do have designated smoking areas, but I feel that it should be banned completely because it still puts non-smokers at risk just due to secondhand smoke. Just a few of my research questions that I wanted to answer with my project were, does the public feel that smoking should be banned in all public places due to the exposure of smoke to non-smokers, or how many deaths does secondhand smoke cause each year? Just a couple of quick facts from various articles and journals that I read about it. Secondhand smoke causes about approximately 7,330 deaths from lung cancer and almost 34,000 deaths from heart disease each year. Secondhand smoke contains numerous of toxic chemicals, including formaldehyde, benzene, vinyl chloride, arsenic ammonia, and hydrogen cyanide, and almost 24 million, or about 30% of children in the U.S. have been exposed to secondhand smoke, and most of the time it's due to because their parents are smokers. What my hypothesis is if smoking is banned in public places, then the risk of exposure to smoke will decrease. If smoking is banned in public places, then deaths associated with smoking will also decrease. So I have two different hypotheses that I came up with. The design for my research project is strictly research-based. I collected a lot of data from the GSS website, mainly in public opinion data, along with additional data regarding disease from various sources and journal articles. Like I mentioned before, I got a lot of my information from from an article titled "The Health Consequences of Smoking," which is a report from the Surgeon General. Just a couple more of my research information. What does this mean, and what I mean by what does this mean is what would banning smoking from public areas do for us? What does this mean to us? It means that as long as smoking is prohibited in these areas, people will continue to see an increase in smoking-related diseases. There's also some evidence suggesting that secondhand smoke might also be linked to other forms of cancer, such as in the larynx, the pharynx, nasal sinuses, your brain, and even linked to breast cancer. So what does the public have to say about this? So should smoking be banned in public places due to the risk it places on secondhand smokers? What I found when I did my research was that the public opinion is fairly divided. I think because there's usually a good percentage of people who are smokers, and there's always a good percentage of people who are non-smokers. So it was about 50-50 when it came down to the facts from the GSS website. So it said that 45% agree that it should be banned, and 48% feel that it should not be banned. So that's public opinion from the GSS website. My next graph, well, it's not really a graph, it's more of a chart. It just shows the impact of smoking on disease and the benefits of smoking reduction. And it really just talks mainly about the types of diseases and the number of deaths that it causes between men and women, based mainly upon various different types of smoking, of course, along with the various diseases that are listed on the left. And if you look, you can see that smoking has caused an estimated total of 263,600 deaths in males and 176,500 deaths in females. in the United States from the years 1995 to 1999. Though this chart is a little bit outdated, I still feel like the information is really relevant still, just because people are still smoking and it's still at a very high number. If you take a look at the second one, it talks about death prevention, and so these results to me demonstrate that by reducing smoking, prevalence can prevent millions of deaths and prevent even future deaths, even if you by reducing the amount of exposure to the smoke. It also stated that modest reductions in youth and adult smoking could prevent almost 2.5 million deaths. The second, my third and final graph is pretty much just shows secondhand smoking exposure among non-smoking adults. And from that, really what can be concluded is that somewhat based upon your poverty level, you're more likely to be subjected to seeing that and getting that secondhand smoke from somebody else. And so it kind of varies amongst different populations of people. So what are our results? From the data, it can be shown that it can be concluded that the public opinion on the topic prohibiting smoking in public places is very evenly distributed, meaning that it's about 50-50 on both sides almost. People either disagree or they agree. Although the data is vastly divided, one can still conclude that exposure to secondhand smoking increases the individual's chance for disease. And smoking can cause other diseases to develop along a person's lifespan. Like I said before, various types of cancer, heart disease, different types of infections in the lungs or in the throat. And it can also cause a lot of oral damage in your oral cavity in your mouth as well. So should smoking be prohibited in public places? According to the research and according to the various opinions that I received from articles and journals that I've read, I can say that I feel that smoking should be prohibited in public places because I feel that it poses risks onto non-smokers and to mainly really just people in general. It poses a different type of risk because you're being exposed to chemicals. You know, I feel that it is your choice to smoke or not smoke, but I feel like I should not be subjected to somebody else's habits. I also put, in order to prevent diseases associated with smoking or secondhand smoke, further legislature and further laws must be passed in order to prevent this sort of thing. If you can look at the picture here, I thought this picture was always really interesting. It's always one of those side-by-side lung photos of non-smokers here versus smokers. And I mean, just the effects that you can see on just the lungs here is just so extreme. So what's next? What are we supposed to do about this? Well, in order to prevent smoking-related diseases, public opinion must be swayed in order to increase the possibility for change. You have to convince people that smoking is bad for them, especially the non-smokers. A lot of times you see a lot of commercializing the damages of smoking through mainstream media, like commercials and for various types of advertisements. But, you know, it's really just about getting through to people that this is something that's bad for them and that it needs to be changed. Research can further be continued to address the issue on smoking-related disease, maybe talk about prevention, maybe talking about ways in order to repair and heal and recover from smoking, or learning how to, or really just doing more research into the effects of secondhand smoking and how really much does it affect more than just versus a non-smoker versus a frequent smoker. And that's it. Thank you so much.